Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today I will be talking about acne or pimples as we call them. So acne is one of the commonest thing that a person suffers from. More than 80% of people from the age of 20 to 40 have suffered from pimples at some point of time in their life. In the younger age group, that is during puberty, it is more common in boys as compared to girls. However, later, let's say 35 plus or 30 plus, it is more common in women than in men. Now, before we delve into acne and its types, let's see what exactly happens. We all know that we have a hair follicle. Our skins have hair follicle. At the base of the follicle is the bulb, from which the hair will come out is the shaft. And then there is an opening from which the hair comes out and where we can see it. Next to the shaft is a small gland, that is a sebaceous gland. This gland is going to produce the sebum, which is going to, it is an oily substance which will lubricate the hair and prevent it from becoming dry. So daily what happens in this, there will be dead cells which will be passed up along the skin pores to be out of the skin. At the same time there is sebum also coming to lubricate the hair. Both these things are traveling upwards and getting out of the skin. However, what happens is when the skin pore is blocked due to some or other reason, these cells keep accumulating inside, the dead cells. Then they mix with sebum, and what happens is it is a very good ground for the infections or the bacteria to grow, and this is how most of the acne start. Apart from this, there are also hormonal reasons why we would get acne. We will see that later. The commonest place where you get your pimples is your face. However, a few months or a few years later, people start complaining of acne even on their neck, back, shoulders and chest. So what are the causes of acne? Initially, we would all think it is a genetic cause because many a times they are predisposed to acne. Hormonal causes, especially boys in their younger age group, because the male hormones or the testosterone causes increased sebum production, making them predisposed to acne. For girls also, the hormones which are premenstrual hormones, or it is a premenstrual phase where you will see the acne is coming. Many a times they tell us, when we take their histories in detail, when do you get the acne? They say just 2 days before my periods I start getting the acne, and once the flow starts, they are gone and they don't come back till the next cycles. Here we know that the cause is hormonal. Third important cause, or the later important cause, is using too many cosmetic products and not washing your skin well. These are few important causes. Along with this, high consumption of alcohol, tobacco, smoking is also predisposing people to an unhealthy skin. Now acne in practice or practically we would grade into 4 types. The initial ones are called as the mild or stage 1, where you will see a small eruption. However, the eruption looks red, it pains a bit, there is no pus, no blood. Then they progress to stage 2, wherein these eruptions become little bigger in size and are pus filled. They are still present mostly on the face only. Third stage, which is again a progressive stage as the problem progresses, is where the eruptions will increase in size, they will become hardened and they become hardened, nodular, pus filled. And this is a very painful condition, and in this stage usually they start appearing every other place in the body, that is the chest, the back, the shoulders, the hands. Stage 4 or the higher stage, wherein the size increases of these eruptions, the depth increases, the texture becomes more hardened and cystic, and it is extremely painful, and then the scars start to appear on the skin. This is how we see them in practice. The treatment part, which we will always speak, here again there are 2 things. One is the lifestyle modification and one is the homeopathic treatment. Lifestyle modification alone will not help in the treatment or a long-term treatment of acne. You have to take medicines so that it happens faster. So as always, we will take the details of the case When the acne come, when did they start? What was the stress factor when it started? Stress itself may not start the acne. However, prolonged stress will aggravate the problem. So then the full case is taken and a prescription is made. As we saw earlier, initially it is an eruption, then it becomes more pus filled, and then it increases size and hardness. So while we treat them, we inform them that first it is the hardness and the pus that has to respond. First that will be responding, and then the acne will completely go. Which means today I prescribe and the next month the face is not going to be clean. However, the more progressive symptoms are the ones which are first to respond, and that is how the treatment progresses till they have a smooth skin. In lifestyle modification, it is very important to avoid alcohol, high amount of caffeine. Some people notice and tell us that whenever they have excess sugary foods, they get their acne. So in such cases, you should avoid what absolutely aggravates your skin condition. Third is, wash your face daily. Keep it clean, keep the pores open. When people use cosmetics, many a time they forget to wash off these cosmetics, and they are the ones which will clog the opening and be the reason for the acne. In such cases, you have to remember to wash off the makeup well and use products which your skin can tolerate. I am currently practicing in Sapley's Polyclinic, Malik Building, D.V. Deshpande Marg, Shivaji Park, Road number 4, from 10 in the morning to 8 in the evening. You can also follow me on YouTube, Instagram and Facebook. I have recently published my second book on homeopathic medicines under B-Gen Publishers, titled Unlocking the Boger Synoptic Key Part 2. This book will be helpful for homeopathic students, young doctors, to help them think and gain more knowledge in seemingly difficult cases in practice. Thank you.